By being able to concentrate on my patients and their images and not having to constantly look back and forth in any single dictation that I do, there is a saving of probably 30 distractions. And there is nothing that contributes to stress during the day for a radiologist than distractions, as well as medical errors. Every single time you're distracted, whether it's having to constantly avert your gaze from your patient back to the reporting platform, every time that you don't have to do that and you can focus on the images alone, you remove a distraction. And in any individual report, I'm saving upwards of 20 to 30 distractions, especially on a CAT scan of the chest, abdomen, and pelvis, or an MRI of abdomen. There's so many things to talk about and so much to look at there that I have found it to definitely reduce stress and fatigue, in both mental and emotional fatigue, but also literally physical neck and eye strain type fatigue, by the fact that I can now concentrate on the images. And for me, the thought of now having to going back and forth between PowerScribe and my images, PowerScribe my images, PowerScribe my images, back and forth, back and forth, back and forth on every report all day long, it's an unacceptable thought to me. The number one cause, in my opinion, of medical errors in interpretive radiology is distractions. It's the number one cause of mistakes because it breaks your concentration. It breaks your flow. You may forget what you were looking at or talking about once you can get going again. And yes, things can fall through the cracks. And now, again, my attention is 100% on the patient. Don't you want your radiologist to be able to focus his or her attention on his or her patient? I mean, isn't that what we should want? And the problem is radiologists don't know that they can want that. That's the epiphany. That's the paradigm shift.